Welcome, everyone, to our podcast on psychiatric mental health nursing. Many new students feel both excited and uncertain when starting this journey. Dr. Carter, why does mental health nursing often seem mysterious or intimidating to newcomers?
That's a great question. Mental health involves complex aspects of human behavior, emotions, and relationships, which can feel less tangible than physical health. The unfamiliarity and social stigma often make it hard for students to picture the day-to-day realities of this field.
So, to help demystify things, today we'll explore the history, key concepts of mental health and illness, and the evolving role of nurses in this specialty. Let's start by clarifying what we mean by mental health versus mental illness.
Absolutely. Understanding these definitions is foundational, especially since societal and cultural perspectives play a massive role in shaping how we view mental wellness and dysfunction.
The World Health Organization describes health as a complete state of physical, mental, and social well-being, not simply the absence of disease. How does this definition influence our view of mental health, Dr. Carter?
It reminds us that mental health is proactive and positive. It's about having satisfying relationships, resilience, a sense of purpose, and emotional stability. It's not just the lack of symptoms, which is a common misconception.
And because culture shapes our values and beliefs, what one society considers healthy might be seen as maladaptive elsewhere. Could you give an example of how cultural context changes the interpretation of behavior?
Certainly. Assertiveness might be valued in the US, but considered disrespectful in other cultures. This highlights why mental health assessments must be culturally sensitive, as behaviors aren't universally interpreted the same way.
We often talk about mental health as a dynamic state, constantly influenced by various factors. Can you break down these key influences for us?
Of course. We can categorize them as individual factors like genetics or coping skills, interpersonal factors such as communication and social support, and social or cultural elements, community resources, societal attitudes, even exposure to violence.
It sounds similar to how a plant needs good soil, sunlight, and water. If any element is lacking, growth is affected. Would you say that analogy holds for mental health?
That's a great analogy. Just as plants thrive in supportive environments, people need psychological, relational, and societal nourishment to maintain their mental health. Lack in any area can increase vulnerability to illness.
Let's transition to mental illness. Disorders like depression, anxiety, and schizophrenia are often misunderstood. What distinguishes mental illness from just bad behavior or a rough patch?
Mental illness involves patterns of thinking, mood, or behavior causing significant distress or impairment. Unlike temporary struggles, these conditions persist and interfere with daily functioning. However, distinguishing illness from maladaptive behavior can be challenging, especially when social factors are involved.
So, are there debates within healthcare about whether certain behaviors are disorders versus responses to environment?
Yes, absolutely. For instance, some argue that chronic criminal or violent behavior reflects personality disorders, while others see it as a response to social exclusion or trauma. This debate affects both diagnosis and treatment approaches.
Diagnosing mental disorders is notoriously complex. The DSM-5 provides a standardized language for clinicians. How does it facilitate better care and communication within the mental health field?
By offering clear criteria for each disorder, the DSM-5 reduces ambiguity and ensures all professionals are literally on the same page. It's like a universal map, whether in New York or Tokyo. Clinicians use the same landmarks to guide diagnosis.
Does the DSM-5 also consider medical and environmental factors beyond symptoms themselves?
It does. The DSM-5 framework includes medical conditions, psychosocial stressors, and environmental challenges, helping practitioners build a holistic understanding, not just assign a label.
To understand where we are today, it helps to look back. How did ancient societies view mental illness, and what were some early responses?
In ancient times, mental illness was often seen as divine punishment or demonic possession. Treatment ranged from rituals like exorcisms to harsh measures incarceration, starvation, or even burning at the stake, reflecting fear and misunderstanding.
It's sobering to realize people were sometimes revered or persecuted based on their symptoms. Did any early thinkers try to link mental health to physical causes?
Yes, Aristotle proposed that imbalances in body fluids, or humors, affected emotions, a theory leading to treatments like bloodletting or purging. While erroneous, it marked a shift toward biological explanations.
Fast forwarding to the 18th and 19th centuries, how did the Enlightenment transform care for the mentally ill?
The period sparked a movement toward humane treatment. Figures like Philippe Pinel and Dorothea Dix advocated for asylums as protective havens, emphasizing nutrition, shelter, and dignity for patients' revolutionary ideas at the time.
But asylums eventually developed negative reputations. What went wrong?
Overcrowding, abuse, and isolation became rampant as patient numbers soared and resources lagged. The original ideals were lost, and insane asylums became associated with neglect and suffering.
With the rise of psychiatry, how did scientific approaches shape modern mental health care?
Sigmund Freud's psychoanalytic theories helped society see mental illness as a medical issue rather than a moral failing. Emil Kraepelin began classifying disorders by symptoms, and Eugen Bleuler coined schizophrenia, paving the way for evidence-based treatment.
So, psychiatry moved from blame and punishment to study and treatment. Are there lingering debates about biological versus psychological roots of mental disorders?
Very much so. While brain biology is crucial, social and psychological factors remain significant. Modern care tries to integrate all these perspectives for a comprehensive approach.
The mid-20th century saw a revolution with new psychiatric medications. How did drugs like Thorazine and lithium change mental health care?
These medications made it possible to reduce agitation and psychosis, allowing many patients to leave institutions for the first time. Hospital stays shortened, and community-based care became feasible, shifting the paradigm away from long-term hospitalization.
This led to deinstitutionalization and the growth of community mental health centers. But were there unintended consequences?
Yes, many community supports never fully materialized. People with serious mental illness often lacked adequate resources and found themselves cycling through hospitalizations or experiencing homelessness, a phenomenon called the revolving door effect.
Today, despite medical advances, millions remain untreated. What barriers currently prevent people from receiving mental health care?
Barriers include insufficient community resources, insurance limitations, stigma, and lack of culturally relevant services. For example, less than half of adults with severe mental illness receive treatment, and homelessness among this group remains alarmingly high.
How does managed care and insurance parity impact access to psychiatric services?
Managed care aims to control costs but can restrict needed services. Parity laws have improved coverage, but loopholes persist, and mental health funding often lags behind physical health. This affects not only patients but also families and communities.
Looking ahead, what are the key objectives and strategies for improving mental health care in the 21st century?
Initiatives like Healthy People 2020 aim to reduce suicide, increase access to services, and integrate mental health into primary care. Emphasizing community-based programs, rehabilitation, and employment support is crucial, especially for marginalized populations.
And with growing cultural diversity, how can nurses provide sensitive and effective mental health care?
Nurses must understand cultural norms, family structures, and communication styles. Tailoring interventions to individual backgrounds, whether for recent immigrants, blended families, or LGBTQ+, individual ensures respectful, competent care and better outcomes for all.